Hi everybody, this is Dr. Ed Park from Recharge Biomedical, and today we'll be talking about tinnitus, potato. Well, most people say tinnitus. So what is it? Well, people describe it differently, and we'll get into that, but let's talk first about what sound is. What we see is just like the color, the visible light spectrum has an infrared and an ultraviolet. So too do we have a spectrum of sound that is subsonic, too low for us to hear with our ear, and supersonic or ultrasonic, which is above 20,000 hertz. A hertz is a cycle per second. When you talk about your bass, that's about 20 to 100. And the piano keys are in this range, the really low ones. That would be bass, upper bass, mid range. Of course, music is based notationally on frequency. So they adjusted from 432 to 440. 440 is this A above middle C. And if you realize every time you double the frequency or have the length of a string or whatever is vibrating, you double or you have an octave. So, of course, A is 440. The A above that, if you look at the number chart, is 880. And then above that is two octaves, 1760. So what we're hearing when people are playing music or singing are just frequencies. And the audible spectrum goes up to 20,000. As we get older, presbyacusis happens, just like presbyopia is old vision. This eye cannot see close up. We lose the higher end, so that dark blue starts to contract in. Very, very cool. We see that in the ear, there's this little snail, the cochlea, and just like this gentleman playing the saw, the higher tones are on the outside and the lower tones are on the inside. So on the outside of the snail, we have the sensing of the higher tones up to like 8,000 hertz. Again, that would be four octaves above that A or whatever. And then the lower frequencies are towards the middle of the cochlea. And this is called tonotopography. So on the brain, as you might expect, there's a mapping in the auditory cortex. Same thing to my right or my left, I guess, whatever you're seeing. The base of the cochlea, 1600 hertz, high frequency, is towards the back, dorsal side, and it maps out the lower frequencies towards the ventral side. All right, so today that's sound in a nutshell, and we'll get back to intensity later. But what is tinnitus? It's ringing in the ears. What caused it, we'll discuss. We'll present a case. We'll speculate why it could have helped and talk about whether you should try it. So, most people describe it as a ringing, a buzzing, a roaring, a hissing. It's kind of like there are videos on YouTube you can hear the various sounds. It's just like you might expect, like an electronic static or a whoosh, or sometimes a single tone. And that you can imagine is due to an injury in that region of the brain, or tonotopographically in the cochlea, or in the nerves in between the cochlea and the brain. So there's a lot that can go wrong. A very common thing, about 10 to 15% of adults have it, and above 55, allegedly a third of people have it in some form. Now, I have it intermittently at night sometimes. It'll just be brief, lasting seconds. It's like a high-pitched ee. But apparently, many of our fellow humans are walking around with this constantly. And depending on the relative noise level of it, it can be quite a detriment to their quality of life. As I mentioned, there is tonotopological representations in the cochlea. So there's something electronically going wrong. What's going right is that amazing mammals, humans have this thing, the ear. And let's talk a little bit about the ear, because it's pretty hard evidence that there is divine creation, in my opinion. I mean, this is such an amazing structure. Outside, we have the auricle, the ear, and then that's the outer ear. The inner ear starts at the eardrum and is filled with air, and it equalizes with the eustachian tube. If you've ever been diving, you have to close your nose or blow. That'll equalize the pressure between your nasopharynx and the inner ear. Of course, pressure can be very painful if you don't do that while diving. Inner ear filled with air, filled with these three bones: the hammer, the anvil, and the stapes, which looks like a little saddle. not saddle, but the stirrup, I should say. And these three bones actuate the movement of the eardrum to membrane on the little snail. It's called the oval window. And the oval window, you can see in the black and white cartoon above, is where the fluid comes in, and the release valve on the other side is the round window. So it's basically a snail comprised of a spiral, and the fluid vibrates, and then it makes these little tectorial membrane vibrate, and depending on which hairs they are at which portion of the snail is what frequency you are hearing. Amazing. Also, the snail has this little three directional X, Y, and Z semicircle canals, and that tells you your position in space. And so collectively, we have the outer ear, the inner ear, which is filled with air, and those three bones. And then the inner ear is the snail with its little directional sensor. The inner ear is where the problems start to arise with tinnitus. So, what causes it? Well, it's a subjective symptom. It's not a hallucination. I mean, I guess if you have a fixed, firm idea that somebody is monitoring your brain thoughts and transmitting them, that's a delusion, a hallucination. Or if you see things that are not there, like white rabbits, then perhaps that's a hallucination. But it's mostly when we talk about tinnitus, we talk about something the person hears, but we cannot hear. And it's because there's an electrical malfunction somewhere, we presume. Meniere's disease is a disease of the inner ear, of that little snail. And that said Van Gogh might have had it, but it typically causes vertigo. In other words, because your body can't sense where it is in space, you feel dizzy, like the room is spinning. That is vertigo. There are certain drugs well known to destroy the inner ear. They include chemotherapy, even aspirin at high doses. Lasix is a common drug for urinating. They give it to racehorses, and also for blood pressure control. And antibiotics, specifically the aminoglycosides such as gentamicin and vancomycin. When we used to treat people in the hospital, we'd have to dose their gentamicin based on their body weight because there's a very narrow range of safe usage of that drug. We have to titrate it to a specific level. So the inner ear is the snail. What transmits the snail to the brain is cranial nerve 8, the vestibulocochlear nerve. This can be damaged by what's called a vestibular schwannoma, which is just an unusual tumor of that nerve. Let's look above me. There's a crass mnemonic for numbering or naming them from front to back or from ventral to dorsal. Olfactory, optic, oculomotor, trigeminal, trochlear, abducens, facial. Anyway, it's ooh, 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 to touch and feel. Girls blank. How awesome, or whatever, HA. And that's just how people would remember. So what we see is the vestibulocochlear is that purple one entering the brainstem. This is looking at the brain from below. Cranial nerves are neither spinal nerves, and they're not brain cells. They're what come out at the base of the brain. These are the cranial nerves. So the vestibulocochlear controls the vestibule, which is the semicircular canals positioned in space, and the cochlear, which is hearing itself. So any damage to that can be a problem. There's a strong association with tinnitus when we talk about presbycusis, which means hearing loss from old age, and also noise-induced hearing loss, meaning people who work around guns, rock musicians, jackhammer operators, in other words, or people who are on the tarmac. There's a strong association with that, and it stands to reason you're doing damage to the inner ear and its nerves and the brain cells. Who knows? In fact, it's very complicated. There's actually 6 orders of neurons. It could be argued that from your hands to your brain, maybe 2 or 3 orders. Basically, if we work back from that map on the cerebral cortex of the auditory cortex, everything switches in the thalamus. That's the relay station that's in the middle of the brain, okay? So if we count the hops, or the number of connecting neurons, there's about 6. So you go from the cortex, again, look at the cartoon in the middle of the slide. We go to the thalamus, that's relay 1, then down to the inferior colliculus in the midbrain, that's 2. From the midbrain down to the medulla, that's 3. From the medulla down to the superior olivary nucleus, that's 4. From the cochlear nuclei down to the spiral ganglion, that's in the inner ear, that's 5. And then from the spiral ganglion to the hair sensors, that's 6. So anywhere along this this path, you can get a problem. So it's complex. Okay, now anybody that has severe tinnitus knows this from their own internet research, that tinnitus is common, it's chronic, and it's untreatable. And, the patient will discuss she had many years of trying and researching. There's nothing out there. Nobody knows what caused it. I mean, unless you do know what caused it. Let's say you were a rock musician and now you have damaged stuff, different story. But a lot of people suffer from just this chronic tinnitus and they just bear it. Hearing aids and cochlear implants can help, and that's because they're turning up the other noises and you're not hearing the noise in your head. It's sort of like do-it-yourself noise cancellation, although the specific ability to create the anti-wave or the opposite wave, let's say you had a single 440 ringing, I guess you could create a subtraction wave like noise-canceling headphones, but that's not really ready for prime time. CBT is cognitive behavioral therapy. If the noise in your head is driving you nuts, there's ways you can learn to use cognitive behavioral therapy to deal with the stress, anxiety, depression, whatever. And that's just, breathing, focused relaxation, etc. So let's talk a little bit about the decibels. It's a logarithmic scale. Every 10 is 10 times greater. So if you're whispering, that's sort of 30. The ASMR is 30. Quiet, 40. There's still noise in a quiet room. On the other end of the spectrum, painful stuff, firecrackers, gun blasts is 140 decibels. Jackhammer is 130. A chainsaw is 100 decibels. We have a vacuum cleaner is 70. So depending on how much hearing you've lost, it's qualified as mild. That's if you lose up to 40 decibel range. 40 to 70 is average, and severe is 70 to 90. Of course, people do go deaf. The treatment algorithm is kind of a common sense joke here in the middle. You see, if you have ringing in the ears, you take a history, of course. You examine the patient, of course. You do audiology, of course. And you get the patient, you can use these YouTube videos to have them describe which is the sound that you hear and how loud is it relative to these other sounds. It can be challenging sometimes when people have concomitant hearing loss, but nevertheless, if there's a secondary cause, and technically speaking, tinnitus, like let's say you had a whooshing in your ear from let's say a pulsatile sound, that could be like an aneurysm or stenosis or something, AV malformation. Of course, you should remove this secondary cause and reevaluate. But usually it's primary, something electrical, neurological, sensor neural. If it is not bothersome, it just says, just reassure the person. If it is not bothersome, but there's hearing loss associated, then you should be evaluated by an audiologist and maybe an ENT. Of course, if it is bothersome, then basically the treatment is nothing, unfortunately. So let's talk about KH, a 79-year-old woman, and she had severe chronic bilateral tinnitus. It began 25 years prior when her son had a motor vehicle accident. He was severely burned, ended up becoming quadriplegic, and had 3 years of very difficult rehab. And so the amount of stress on her was tremendous. And this stress is kind of, I presume, caused brain damage, quite literally. So she has a benign essential tremor. She had bilateral tinnitus. Notably, of the time, she had no exposure to the usual loud noises, viral illnesses, or medications. So there wasn't that to blame. It was just brain stress. And again, if we look above at the cartoon, stress is a killer on many levels. It produces inflammation. It allegedly decreases BDNF, that's brain-derived neurotrophic factor. It increases the amount of cortisol, which is an immune suppressor. It's bad all around. So on last March, she had 3 billion IV exosomes and 1 billion into each nostril, with the hopes that it would infuse up along the cribriform plate into the brain. There was some spillage. It's very technically difficult as a person is moving the needle. Sometimes the needle will dislodge. So I always make sure I ask them, is there dripping? Is there dripping? Slight spillage on the right side, perhaps related to why the right side didn't get as better. But nevertheless, a miracle occurred, and her tinnitus went away on the left, and it went from 8 to a 4 out of 10. It's really like a light rain, like a coming out from both ears that she had. Her hearing, unlike others, was always normal, so it's not as much inner ear cochlear as I think in the brain on the cortex. And of note, her knee pain also got a lot better on this very small dose of exosomes. So why don't we pause this here, and we'll come back and we'll listen to her testimonial. One moment, please. If you can. Ready?
Do you mind if I use your testimonial?
Absolutely.
Okay.
Go ahead. Yeah, the exosome, it's gone in my left ear. I wanted to tell you that. I don't know whether there's something corresponding there. I would like to think that there is. So
What about the
I don't know.
What about the right ear?
I still have it.
Well, that's weird. Is it more troublesome to have it in just one ear, or is it half?
No.
Okay.
It's a big relief.
Okay. Huh. Wonder why that would be. So you just ignored for 20 years?
Yeah, they say there's nothing that can be done for it. I mean, I have done a lot of research on it, and they just say that there's nothing that can be done.
Nothing makes it better or worse. It's just always there.
Yes.
How many days after did you notice the difference? Or was it right away?
It just continued gradually declining from before I had the exosome through, say, the first 2 weeks of having the exosome, and then it was gone.
Gone. Wow. Fascinating.
Yeah, I mean, I'm absolutely thrilled to death that, it is so annoying and I had a lot of difficulty going to sleep.
Yeah.
When things are quiet. I actually went to...
1 to 10, how loud is it?
Before, it was probably an 8.
Wow, it's loud.
And now it's probably a 4.
Just on the right?
Because it's just on the right, yeah.
Wow. So both sides got better, it's just the left went away pretty much.
Right. Because the arthritis is just absolutely amazing. Oh my gosh. My legs were getting very stiff, and going up and down stairs was, difficult, and my balance and all of that because it was so stiff. And now, I mean, I walk up 62 stairs over at the park when I'm doing my walk, maybe 3 times during my brisk walk for 45 minutes to an hour. And I don't have a problem.
So even without injection into the knee, it helped that much, huh?
Right.
That's great.
It is. I mean, that's why I'm going back. Because if it can do that for, my knees and the arthritis, then I'm ready for some more.
Okay.
So let's talk about 2 other non-responders. I guess you could say it's a 1 out of 3 response. I mean, I don't really believe that, but regardless, she had a miraculous improvement in her tinnitus, and God knows why. PD is a 75-year-old man who has chronic tinnitus. He did have a noise-induced hearing loss event, loud music. He remembers the concert. And he had great results with his low back pain with radiculopathy, both of which resolved after an epidural exosome injection. So he thought, well, I'll try it for my ears. So we did 6 billion, which is 1 cc of 3 billion each into nostrils. He said that his mental function and his libido improved, but the tinnitus did not improve. So we must not have gotten it to the right one of those 6 neurons, or the cortex, or probably the cochlea. FI is a man, a 52-year-old with a right single-tone tinnitus. As one particular note that he's identified. And again, he had a very stressful time in his life, and then they went to a loud concert, and that's when he marks the beginning of his problem. We attempted 3 billion IV, and we did 1 billion into the right nasal. Arguably, could have done both. And then we had 1 billion into his otic canal, dripping it, lying there for half an hour. Hopefully, it'll transfuse, being very small, into the inner ear from the middle ear. Unfortunately, unchanged. So, what does this really mean? It might mean that this kind of very common noise-induced hearing loss is not amenable, or maybe there's no direct access to that nerve. Really, it's very hard. You can't inject things around the brainstem, or can't really, that I know, go through the palate. Transtympanic membrane, maybe we could inject into the eardrum, have to numb that up, and technically it is a eardrum perforation. Might be a technique that I'll be willing to pioneer in the future. It is used for Meniere's, and they inject steroids with some relief. But again, when you do clinical medicine, there is a comfort level, there is a trial and error, and so we have to wonder. Most people don't like stuff put in their ears or their nose, and it's highly difficult. Just to recap, for those that don't know, exosome is a 100 nanometer sphere with mRNA mainly and some protein and lipid in it. Same size as the virus, corona, HIV, because it uses the same machinery to be packaged. So this puts it at about 1/200th to 400th the size or diameter of a regular cell. They're tiny. They're not cells. They don't have their own machinery. They don't have their own DNA. And they don't have self-antigens on the surface, so they do not cause an immune reaction, a host versus graft disease per se. So how is this working? Well, we really don't know if it is working, if it's placebo. I guess if it is working, as with the other webinars I did on nerve injury and stroke rehab, could be causing remyelination of nerves. Perhaps there's certain oligodendrocytes in the brain or Schwann cells in the peripheral nerves that need to remyelinate. Think of it like a live wire. You have a live wire, it's fritzing out, it's causing signals. If you put black electrical tape around it, it's insulated. Maybe that's what's killing that live wire. It's broadly anti-inflammatory. Could be reducing inflammation. It's argued that depression, mental illness, all these things are inflammation of the brain, perhaps. Regenerating damaged cells via dedifferentiation is something that I talked about in the webinar on nerve injury. There are certain microRNA, interfering blocking RNA, which block the transmission, block the translation of certain dedifferentiation stoppers. So in other words, if you block the blocker, the cell can behave primitively, act like a little naive cell and regenerate. And finally, apoptosis, which is programmed cell death. There might be some cells that need to die, that cannot die for them to be replaced. That could be taking place. All of the above, any combination, we don't know. So in a nutshell, I don't know if it helped her. It seemed the time course is very suspicious for it helping her. Perhaps a tinnitus of a central brain origin is more amenable. Maybe we just got really lucky. Of note, her benign essential tremor did not go away. So it's a little too early to tell based on these 3 cases whether this is something that would work for you. But on the upside, most people who do a nasal injection do feel, oh, my brain is sharper, my memory's better, my mood's better. And a lot of people say their libido increases. And of course, it stands to reason that if you're getting into the brain, hypothalamus and pituitary can be sort of freshened up, I suppose. If you have questions, you can email me at drpark@rechargebiomedical.com. That's drpark@rechargebiomedical.com. And I encourage you to go to my website and learn more about the science and a lot of other videos on topics. I'm quite sure that there are people in your lives who have bad joints, bad tendons, other problems that would be addressed. Also, happy to announce that I just put in applications for Florida, Texas, and Nevada. So hopefully I'll be practicing there as well as California and Hawaii. All right, everybody. So thanks for joining. This is Dr.